You know, something interesting about our community is we do have so many health practitioners that use these products for personal and also utilize them to help their patients have some type of pain relief without drugs. And it really is pretty awesome. That's a great testimonial, isn't it?
It was phenomenal. It was phenomenal. And it's, you know, it's a great example. It's one of thousands and thousands of testimonials about how practitioners and, you know, also just business people in our community are using our products and helping improve quality of life for people all over the world. It's amazing. It's awesome.
It really is. You know, I think one of the things that some of our members struggle with is they hear these great testimonials, they hear these incredible stories, they've experienced some incredible things, and they just want to share, right? We just want to share. We want to shout it from the rooftops. We have something that will help. But it's so important that we speak about these things in a compliant way so that we're not making claims and we're not doing things that might give people more hope than they should have, right? So can we talk a little bit, David, about how best to speak about what LifeWave, I can't even speak, IceWave, how IceWave works. My gosh, my tongue was tied there. Can we talk a little bit about that?
Yeah, sure thing. So the first thing is no disease claims, right? This is like the most obvious thing. We're not going to make a claim that we're curing anything, that we're treating anything. We don't want to put members in the position that, you know, unless they are a healthcare practitioner, we do not want to put ourselves in the position of being a doctor, which could cause a problem. So none of our patches are used for treating or curing any type of disease. And when it comes to pain relief, because that's the focus today, we're really focusing in on pain management. So this has nothing to do with treating a disease. It's just simply improving energy flow through the body and improving the way the body makes energy to have a better quality of life. So if someone says, well, I have Parkinson's disease and I applied the patches and now I have less pain, that's totally fine because they're making it very clear that it's just the pain level that's coming down. They're not making a claim that the Parkinson's, you know, went away, you know, as an example. And so that would really hold true for any type of health disorder that someone has, that if we're just talking about improving energy flow, improving quality of life, reducing pain, it's totally fine. Well, you know, the governments are weird, right?
Yeah, they are.
Governments are weird. What governments will do is say, okay, you can't make a claim about wound healing. And it's like, okay, well, the human body heals itself. Any drug might facilitate wound healing, but it doesn't actually heal the wound. What it will do is support the natural process of wound healing, which is management of inflammation and activating stem cells, and the stem cells go in and do the job. So wound healing, as an example, is a natural process. So if let's say there's a product that supports the natural wound healing process, the governments, the health authorities don't want to give companies the ability to say that. They say it's a medical claim, despite the fact of it being a natural process. So these are some of the nuances with product claims we have to be careful about, right? Things that you would normally associate as being natural, the FDA in the United States and in the EU Ministry of Health, they consider these things drug claims. But anyway, that's the world we live in, unfortunately.
It is. I know we're planning to do a future call for our community that really talks a little bit about how can we talk about these amazing results in a compliant way. And I appreciate you sharing this perspective specifically on IceWave, because I do know that it is challenging and hard, and people just, again, they want to share because it's so exciting, but we do have to be mindful of those restrictions that we are under, right?
Yeah, and you know, there's going to be people with Alzheimer's disease and ALS, MS, Parkinson's disease, cancer. Those individuals, you know, we should always precaution and say, look, if you want to use these products, go see your doctor and make sure that it's okay for your specific condition. And if your doctor says that it's okay and you want to try it for helping you with your pain, then that's, totally okay. So, so we reduce any liability to the individual distributor and to the company. The doctor, the practitioner, signs off. And of course, because our products are non-invasive, most doctors aren't going to have any issue with it. And then even let's say, someone has a significant health disorder like Alzheimer's, we're not treating the condition, we're just helping to improve their quality of life. So if we stay within those parameters, we're okay. Despite the fact that, I think many people will say, well, this looks like it can be more than what's going on than pain relief. That's wonderful. We just don't make that claim.